Thank you very much. Thank you, Mr. Lai, for your introduction. I'm very honored to come to Shanghai again, especially today. Today we have witnessed the journey and achievement by icing the Ili, and you have just finished the 3,000 cases, and this volume of the cases has been the sum of the all the number of cases in the other provinces. So we'd like to congratulate the Ili and her teams for this great achievement. The workshop today is hosted today, and this has reminded me that last year in Thailand we took part into the academic meeting, and Professor Li Qiliong was also at that meeting, and the APED meeting was hosted by them, Professor Li Qiliong, and also the Professor Zhang from KK Hospital in Singapore. We were together back then, and Li Qiliong just said one sentence to me, and back then we were at the meeting. We were looking at the live video of the surgery, which is the microwave ablation. We can see that there are bleeding coming out of the needle passage, and the doctor said that no need to worry. When I just retract this needle, we will just ablate it, and this bleeding will be stopped. And back then, the Professor Zhang said that this is not doctor, it's a cowboy. He's a cowboy, and the gynecological doctor understood that knows the risk of the ablation to stop the bleeding, and I think also said that the risk is the fracture of the uterus, and the gynecological doctors understand that, and during the microwave ablation surgery, and the gynecologist said that the doctor was a cowboy, not a doctor. And another doctor said to me that he cited a sentence by a British philosopher in 18th century. It means that the silence of the kind people is the only condition for the devils to win, and the gynecologist understand the HIFU, and today we know that the advantage of this technology, and we know how the doctors could use this technology very well. So we need to let the more people to understand HIFU, and most of the people like us will usually go silent, and we just look at the other persons to do to propagate and to publish their own stories. And Professor Li Qiliong was so anxious, so this time we just hosted this training course in Shanghai, and Li Qiliong was promoting this meeting behind the scene, and his purpose is to let more people to understand this technology and use this technology very well. And the previous two speakers said very well. Today I want to talk about the uterine adenomyosis and the HIFU treatment, and the uterine adenomyosis. The primary choice is the FUAS. This is our agreement. This is our understanding. And if we focus on the FUAS, the mechanism is to just utilize the transmissibility of the ultrasound, and and convert the mechanical effect of the ultrasound waves into the thermal effect, and ablate the lesion to finish the non-invasive treatment of the lesions. So its biggest advantage is the non-invasiveness. There's no invasive approach, and also during the surgery, we have the imaging system, we have the ultrasound image system helping us to just focus on the lesion. So you can see these are the strong myomas in the uterus. After the treatment, the entire lesion has been ablated completely without any damage to the surrounding tissue. So you can see that the myomas under the mucous membrane, under the endometrium has been completely ablated, and the endometrium has been preserved very well. So actually, with the HIFU, we can get what we want. So clinically, about the value of this technology to the adenomyosis, I agree with the Professor Zhang. For this kind of the recurrent disease, we can use the HIFU to just accurately ablate the lesion, and when there's a recurrence, we can just ablate it again. And since 2007, we started to use HIFU to just to treat the adenomyosis, and this case is done on the patient from Yunnan province, and the case is serious. He doesn't want to just do the hysterectomy, and the power output is the 200 watt, and within 260 seconds, the surgery is over, and we can see the scope of this ablation. And during the first case, we did this HIFU surgery very conservatively, and nowadays the power output is the 400 watt, and the timing has been doubled. So the first patient is very lucky, and you can see that the operative outcome is very good. And the patient told us that the surgery is over. I haven't felt anything. So finally, it is reported that the patient had a very good outcome, and this is the first case. It is very simple and successful and simple. So we just started to use the HIFU to just ablate the adenomyosis. We will just decrease the size of the lesion and even completely ablate the lesion and cure this disease. So we started this journey, and in 2010, from 2010 January to 2011 December, we just finished the treatment of the 350 patients of the adenomyosis, and this is the treatment time of the patients. You can see that the treatment time is a very short. Average the time of the period of time is the 1 hour and 40 minutes, and the power output is on average 400 watts. So you can see that it means that not every case is as simple as the first case, and the 203 cases of the patient have the dysmenorrhea, and within 1 year, and they have just got the responses to the dysmenorrhea, and this means that the treatment of the adenomyosis is not as simple. It is a very complicated disease, and after the surgery, the responses are very good. So looking back, we can see that for this is a complicated disease. Another kind of the disease is the uterine myoma. After 10 cases, we can understand with HIFU which case could be difficult and which case would be easy. And we can see that for the uterine myoma, the HIFU surgery is very simple, but for the adenomyosis, the disease, it is very difficult. It is troublesome, the disease. And the Japanese doctor has researched the mechanism, rationale of the adenomyosis and published a paper on the on American magazine. According to the characteristics of the adenomyosis, it has 4 types of the subtypes. The first is first is the endogenous adenomyosis, and this is a type 1. The adenomyosis is localized the endophytic type. Second is the type is the localized the exophytic type. It has no the spanning of the okay, here you can see the lesion here, and it has the contact with the intestinal tract. The third is the intramural types, and the other types are the unknown types. So our teams, I mean the Hemin's teams, and the teams from our hospital has analyzed the thousands of cases of the adenomyosis, and we just categorize them into the 7 types. The first 3 types has been mentioned, and type 4 is the localized full thickness types, and there are the lesions on the endometriums and the corion, and also there are the rest of 3 types are diffuse endophytic the types, diffuse exophytic types, and diffuse full thickness types, and so their sensitivity for the HIFU is different, and the clinical outcome are different, and you can see that in our cases there are the complete responses, partial responses, and no responses. For the type 1, type 2, type 3, and type 5, we can usually realize the complete response. For the type 4, the response level is lower, and for the 5 and 6, type 5, type 6, the response is very bad. And so we know that right now we can communicate with the patient and understand how good the response is. And so for the same treatment solutions, the different type of the adenomyosis has different sensitivity to the same medical and treatment solutions. If there's no requirement for the pregnancy, then we can just expand the scope of the ablation. For if there is the requirement for the pregnancy, then we need to just preserve the endometriums and the serosa. And here, for the type 1, the adenomyosis, that we can just ablate these areas and expand the ablation area, and that is okay. So actually, the endometrium has the very good ability to just restore the cells. For the exophytic, the types of the adenomyosis, we need to preserve the endometriums and the serosa. And for the diffuse, the exotic, and adenomyosis, and if there's no requirement for the pregnancy, then we can just expand the ablation areas, and so we need to just have the good communication with the patient beforehand. If there's any requirement for the pregnancy, then we need to just protect the endometriums and the serosa. And sometimes the outcome is not good, but if the patient has that requirement, we need to just follow their, meet their requirement. And for the HIFU treatment, if we just follow the paradigm of the curing the uterine the myoma, then it is like this. We will just, if we just ablate the series. It has the clear border and clear boundary. Then we can just ablate the lesion. But for the adenomyosis, the boundary is not so clear. So if there's no requirement for pregnancy, then we can expand the ablation area. But if there's a requirement for the pregnancy, then we should not just ablate the neighboring tissues. So for different kind of patients with different requirements, the solutions are different.
So we treat according to dot distribution. So distance from focus to endometrium, distance from focus to serosa needs to be sufficient 1.5 centimeter, dot spacing 5 millimeter. And then the dosage are different in different type according to the image. Is it sufficient or insufficient blood supply? So with more blood supply, we'll have to use more dosage. So within 10 seconds, you can see whether it is enhanced or not. Then you'll see if it's a contrast after showed up after 30 seconds. So it's possible that 5 seconds for each dot. Then, according to patient's response, if she feels painful, then you have to slow down. Their reaction is very important. So according to such approach, we can achieve safe, effective, and comfortable treatment. You see this patient, a 26 years patient, with a previous surgery history. There is a scar, and IVF failed. So she was recommended for ablation. You see 260 seconds. We have completed treatment. MRI. The second day after the surgery, you can see the peripheral structures are being well protected. So IVF 5 months later was successful. And in this case, the patient also had surgery but relapsed. And then for focused ultrasonic treatment, we also had dots distribution. So imaging shows here it's not sufficient, and then after 335 seconds of radiation, dots distribution have been completed. There's an additional treatment of 55 seconds. The treatment was completed. Director Gu are very experienced now. It would be very tough to get the lesion out by surgery. And after HIFU, the patient had a complete remission, and then also I have no worries for her to get pregnant. You see, there was some report about the adenomyosis that had uterus rupture during pregnancy. However, that was because of the way they were treated. So you can see this patient was pregnant successfully 5 months later. This is another patient, and the treatment was completed in 1,311 seconds. Pregnancies were successful after 5 months. This one is the full thickness diffuse type. Previously, we thought it's not hopeful for her to get pregnant, but we treated her according to her requirements. You see, this was a patient in the early stage, and ablation was not very thoroughly. However, she was lucky. She pregnant 9 months after FUAS and delivered a full-term baby. So that's our sharing.